Thanks so much for joining. We're going to give it just another minute to allow for others to log in, and we'll get started. All right, I think we'll go ahead and get started for today. So welcome everyone to the 2021 Virtual SMA Conference. This is Jessica from Cure SMA's Family Support, and we thank you all so much for joining us for the Optimizing Telehealth session today. We are so grateful to our national presenting sponsors, Biogen, Genentech, and Novartis Gene Therapies for their incredible support of this year's Virtual SMA Conference. I did want to note that all lines are muted during the session other than for the speakers. But if you look on the right-hand side of your screen, you'll find the chat conversation tab. Please use this throughout the presentation to submit any questions that you have. And then at the end, we've got some time for the Q&A session, and we'll get those questions answered. And now I'd like to introduce our speakers, Leslie Nelson with UT Southwestern, Dr. Castro with UT Southwestern, and Stacy Tarrant with Boston Children's Hospital. Stacy?
Thanks. Thanks, Jess, for that introduction, and welcome everyone to this Optimizing Telehealth workshop. So I think this has been quite a year for all of us. 2020 will definitely go down in infamy as the year of COVID, but I think it will also go down in history as the year of the telehealth or virtual visit. We all, I believe, had to learn a lot of things very quickly and learn how to, practice healthcare within all of our different specialties just a bit differently. So we're going to start the workshop today by just going over some general tips for a successful telehealth visit. And then after that, we're going to turn it over to Dr. Castro to talk about optimizing the neuromuscular virtual visit. Then you'll hear from Leslie Nelson to talk about optimizing the physical therapy virtual visit. And then finally, I'm going to talk to you a little bit about optimizing the nutrition telehealth visit. Next slide, please. Okay, so some tips for a successful overall telehealth or virtual visit. So first and foremost, it's very important to be on time for the visit. When we were seeing people in person and you'd have, a clinic, sometimes there was, I know at least in our institution, there was a sort of a lot more flexibility on time. And if you ran over with one person, then the next person would be seen a little bit later, but they're in there in the waiting room. But with virtual visits, we don't really have the luxury so much of that backup because you may have a family joining on to the telehealth platform, Zoom or whatever it may be, and if they don't see the provider there when they join on, then they're not so sure. Is the visit going to happen? Did the provider remember? So it is really important to be on time. And we as providers, I know in our institution, we're very diligent about this, and we do try to make sure that we're on camera at the very start of the visit. I know I usually give my patients 10 minutes or so. If they don't join, I will try to give them a phone call, but just remember that the provider may have back-to-back visit scheduled. So if you're not on time for the visit, the provider will likely have to end your visit at the scheduled end time in order to be on time for their next visit. So that's really important.
Stacey, could I say something right
Sure.
there? Because something that happened to me was that every different website or platform that you use for telemedicine may ask you to be 30 minutes before, or 15 minutes before, 10 minutes. Nobody can hold their phone 30 minutes before the appointment, waiting for that provider. So I think making sure that the families understand exactly how much time they really need to be before the appointment helps a lot. And again, each website, it's different. It happened to me. I was 15 minutes before my appointment and I was waiting for 20 minutes and nobody got into appointment. And the other thing that I see that is important, if you have siblings, what happened is that you have 2 different appointments, but you're seeing the patients through the same first appointment. And what happened with some services is that it will cut the visit, and then you have to re-log in for the second sibling. For other ones, you can go through the visit with the 2 siblings, but then it will come up like the other patient missed the appointment. So I just want to make that point. So I think it's important to get to your, specific hospital and physicians and ask them to learn how that is how it works for that institution.
Yeah, good point. Thank you. Okay, the other thing that's very, very important is that the patient actually needs to be present for the visit and also visible to the provider, at least for part of the visit. I have definitely had situations where parents, they have an appointment scheduled for their child, and then they'll join the visit and the child is actually at school or participating in virtual school or something like that. So it is very important for us to be able to see the patient on the camera. And again, they may not have to be like engaged in the visit for the whole time, but they should be visible to the provider. And also if the provider asks you to put the camera on the patient, that they are at least close by so that you're able to do that. You want to try to eliminate as many distractions as possible. And I know that this can be difficult, especially, if you have several children in the house, and especially during COVID time when everybody was homeschooling and that kind of thing. But if you can find sort of a little nook in your house to have the visit, that can really help. The next one, it's like, don't text and drive, don't drink and drive, and don't telehealth and drive. So we at our institution, if we have a family that calls us from their car and they are not able to pull over, we will absolutely end the visit right there and request that they reschedule. So first and foremost, we absolutely want you to be safe. And then I would also recommend, establishing a technology failure contingency plan at the beginning of the visit. I know that in visits that I've had, when my technology fails, it fails completely. Like I may lose, access to my hospital's computer, or my internet completely goes down. And in those situations, if I haven't exchanged phone numbers with the patient, then I don't even have a way to find their phone number, because now I can't even get into their medical record a lot of the times. So that it's a good idea to just establish at the beginning of the visit, exchange phone numbers, whatever you have to do, so that if the technology fails, maybe you can call each other and kind of finish up the visit by telephone. Okay. Deanna or Leslie, do either of you have anything else to add to any of these tips before we move on?
No, I think that what you just said, I did it many times and I never got the phone number before, but I was lucky enough that I had Epic. So I was able to look at it on my cell phone and then click the number, and it uses Doximity to make the call with the family, because many times several times actually, the visit just got caught, in the middle. And the problem for us as physicians, that is not for the families, is that some states, for example, in Texas, we cannot bill for phone calls.
Okay.
So we were able to bill for the phone call initially, but now we're not. So you're supposed to have the camera at some point. And I have to say it, I know not HIPAA complain all the time, but sometimes we have to use even FaceTime. So it is what it is. But I think that I like that point, having that backup number if anything happens.
And I think you bring up an interesting point, because it really does vary from state to state and what the rules are in your state. And it varies from platform to platform too. Like you just said, you have something on your phone that allows you access to that information, whereas I don't have something on my phone like that. So it really is like, it is variable with all providers. Leslie, did you have anything that you wanted to add?
Yeah, no, I don't think so. I think that the general idea you covered very well. I will, when we get to the physical therapy part, talk a little bit more about how the patient being visible to the provider is important, but I can kind of get to that when we discuss that a little bit.
Okay, so now I'm going to turn it over to Dr. Deanna Castro to talk about optimizing the neuromuscular telehealth visit. So next slide, please.
Thank you. So let me start saying that this was very hard for me personally, the whole telehealth thing, because I love to have my patients in person. I love to hug people. I love to have that contact, and it just didn't happen for a while. And I feel like I haven't been able to see my patients, some of them in year and a half. But well, we got used to, and I think we got used to really quick, and we started learning a lot of difficulties through the process. And I think the main issues that we had and that we will continue having is, for example, I'll give the example here in Texas, is that many families didn't have good access to the internet. So if you don't have access, if you don't have a good connection, it's not going to happen. The other part was, for example, cultural barrier. Like some of my Hispanic families don't want to be in the camera. They just don't like to be doing these visits through the camera. Like I said, if they don't do it with the camera, then I cannot do really the clinic visit like it should. So I think as time goes by, we're going to have this mixed kind of situation where we're going to have patients in clinic, and maybe for the follow-up that is not as necessary to have the patient in clinic, we can do a telehealth visit. So that's why I think it's important, this session that we're having, because it still can give you maybe little points that can help, like having the number as a backup. So I would say one of the things that I always ask the families is to try to request an appointment at the time the kid is not going to be tirelessly hungry, because those are the things that they are not going to help us. They are kids, and obviously we don't know, as parents, we know when they take their nap, if it's applicable to that child, or when they get hungry, when they get upset. So I think that's important to know. If we know them, that's a good timing. Talk to your provider and ask them, I need an appointment at this time because it's going to be more helpful. I had several visits where half of the time the kids were showing me their toys, and they did not want to talk about anything else, but they want to talk about Thomas the Train and Paw Patrol and blah, blah. And we talk about those in the meantime while I was trying to observe what they were doing. So I think it's important to have that good, good energy from the child to be able to get a good visit. Like you say, private location, it's hard because families have more than one kid sometimes. So it's hard to get a specific area. Technology we talk about. And then something that is important is to prepare questions and thoughts to discuss. When I go to the doctor, or when my patients come to me, many times they're like, oh my God, I forgot. I wanted to ask you something and I don't remember. So I personally, when I go to my appointments, I get used to start writing, questions and things that I want to discuss. Many of the families with SMA are great. They come with their little notebooks and they have already 15 questions prepared to use. So that's just amazing. So I think we have to try to get that going. Next. And then what about during the visit? So what I'm going to do is I'll say that in neuromuscular medicine, I see when I train my residents and my fellows, I always tell them I want to hear from head to toe. So that's what I was trying to do with telemedicine, trying to go through every system to make sure that I'm not forgetting to check for something. They're very complex patients, and we are not just checking on their muscles and their nerves. We're checking on a whole, right? We're checking on the cognitive, we're checking in the ability to swallow, their heart, their lungs, and so on. So if you want to give me the next one. So something that I found in a paper, in this paper that was published, I think it was last year. It was interesting because it says we still can see patients, we still can do a neuromuscular medicine, a neuromuscular examination through telehealth. So what they did is they came up with this paper saying, these are the things that you can do online to be able to examine the patient. And I thought it was very interesting because I didn't apply it before. And I think something that we can, families can learn to do and we can learn to do. So if you see, you start with inspection. So you start looking at the patient just from the camera, is if there's any muscle atrophy, fasciculations, any abnormal movement, if applies for that patient, scapular winning, things like that. Scapular winning is when your blades, when your scapula just kind of protrudes. So you can have the child take their shirt off and then look at that area. We can see if the gait, I had many of my patients walking back and forth, if they can stand up with assistance, or if they need assistance or they don't need assistance. We do something called finger to nose that many of my patients know. They love to play that game that is touching their nose and touching a finger, touching nose, touching finger. And that's something that the person next to the patient can do. Alternating movements, what we do is we ask them, for example, to put their hand like this and then turn it back and forth really fast. That is applicable for children that are older than around 5 years of age. Before that, they're not going to be able to do it. Single breath count, very important and easy to do. We ask them to take a deep breath, and with one breath, you're going to start counting 1, 2, 3, 4, around at that pace. We don't want 1, 2, 3, 4, 5. No, we want pace, like pace it down and see how many numbers the patient can get to. That will give you actually a good idea of their ventilatory capacity. And then we go through the cranial nerves. So if you see one by one, I'm not going to go by one, but I can give you examples, for example, for our patients. Ocular movements, very easy. You ask the person that is with the kid to hold their head, because they are going to try to move their head every time. So you hold their head and ask them to follow an object back and forth, up and down. You can ask them to hold their eyes, look up gaze for around 20 seconds and see if they come back, the eye kind of gets smaller. So we call that ptosis. So things like that, we can do it at home. You can ask them to close their eyes really tight, blow their cheeks, stick their tongue out, move it side to side. All of those things can be done. And if you can give me the next one. And then when we come today, and I don't know if Leslie is going to talk a little bit about this, but this is part of the muscle exam that even if we have the patient in front of us in the clinic, many times we cannot do the full exam because they are not going to cooperate with the full, hold your hand here and push and push. They cannot. So things like this can be done at home. You can ask them, lay down on your belly and see if you can pick up your neck up in the air, or lay down on your back and see if you can bring your neck up here. So you're looking at neck extension, neck flexion. You can ask them to raise their shoulders. You can ask them to touch their shoulder with their finger, with their hand. So no, you're looking at the biceps. Ask them to straight the arms, so you're looking at the triceps. So each of these things that are named, that are mentioned in there, can be definitely done at home, are things that we can look, and we can even not specifically given numbers because it's hard to tell. We're not actually touching the muscle, but we can describe it, and it can something that we can follow for the future visits. And if you go back, I'm sorry, I should have put that. If you go back 2 of them, right there. So once you do all the things that you can do, obviously everything as much as you can do, and always remembering, as families, as patients, I always empower my families to make sure that your physician covers everything. And if you think head to toe, you will remember. Cognitive issues. Is my child having issues at school? Talk about that. Eyes. When was the last time your child had an eye exam? Is it swallowing or chewing difficulties? Is my son or daughter snoring? When was the last time you saw the heart doctor, the lung doctor, if it's applicable? GI issues down there, then continence. Are they having accidents at nighttime? And then after that, you go that down area, then you start thinking, is there scoliosis? How about scoliosis? When was the last time you saw the orthopedic person? And then you come to the joints. So just always think kind of by system, and it helps you a lot. Take notes. I'm asking you to do the whole exam and at the same time take notes. It's not going to happen. So at the end, take notes, ask all the questions that you have to ask, and then request a summary, because sometimes we talk so much. I talk a lot, and I have to go, and after I let the patient go, I have to type it and make sure that I'm gonna able to give them in the summary of the patient, the list of things that we discussed, because sometimes it's a lot. So those were the things that I wanted to say. And I think Leslie or Stacy, anything that you guys think I'm forgetting in that area?
I don't think
So-
so. I'm not qualified to answer.
And if not, I'll let Leslie keep going.
Thanks, Dr. Castro. I think it's very interesting that there was a paper published so quickly on the guidelines for telemedicine for neuromuscular patients, and you know, I think it speaks to the fact of how important that was. So can we go to the slides after Dr. Castro's list? Perfect. So, so I'm a physical therapist, and obviously I have experience with trying to do a physical therapy type exam in a telemedicine situation, and so things that I would say from a preparation standpoint would really think through understanding that you're not only do you need a private space, but then on top of that, we're going to complicate things by asking you to find an environment where there's space. You know, Dr. Castro mentioned having her patient walk back and forth. Well, you need space to have that, or you may need floor space if we need to see the patient or the child roll or crawl, those different kinds of things. And then you may have to adjust the camera. So I think that speaks to the thought process of planning who is going to attend the visit in addition to the child. You may need 2 people. You may need a cameraman or a camera person, and then a second person that may need to help position the patient in different ways. Or like Dr. Castro said, someone may need to hold the camera while another person holds their head to look at different things. And so that can be complicated, again, on a family's kind of side, because everybody's busy, and we can't all just kind of stop and be there for that visit, but it is important from a consideration standpoint. I think the benefit of telemedicine that I really enjoyed was having the opportunity to see the family's space and their home and their equipment. You know, I mean, they obviously don't bring their standers into clinic for me to be able to assess the child in the stander, and then I can actually look at the child in the stander and give some feedback on how to potentially adjust that equipment if we need to do any adjustment. So that was actually a really nice part of telemedicine that I find very helpful. From an equipment standpoint, I'll also mention, we actually had a talk yesterday. A group from Columbia presented on how they used telemedicine to actually perform their equipment delivery and equipment evaluations, and found that it was very helpful. And I think that they foresee that it might be something that they continue to use in flu season, even when even when COVID potentially is not as big of an issue for us. Flu season is always going to be an issue, and so I think that we may have learned lessons that we may utilize some telemedicine in different ways, from a standpoint of trying to limit exposures when we need to. And so that was kind of interesting to listen to and hear yesterday. And then, just like Dr. Castro said, as far as kind of preparing for your visit, have your questions ready for your PT or your OT or your speech therapist, and maybe that equipment that you have questions about, so that we can take a look and help you with any kind of situations. All right, next slide. So during the visit, I think that one thing that I found very challenging was, again, it probably depends on the platform that you're using, but if you notice, when we speak, Dr. Castro was speaking, her picture came up, and when I'm speaking, my picture comes up. And when I'm trying to watch a child do something, I'm talking them through it, and I'm saying, okay, now I need you to try to crawl, but what I'm seeing on the screen is a big picture of me talking. And the patient is in a little window down in the corner, because they're not being highlighted or spotlighted, because they're not talking. And so it may seem kind of strange if we ask you to, can you keep talking? I need you to do this, but can you keep talking while you're doing that? so that it highlights your video so that we can actually see you in that space a little bit better than having to kind of need a magnifying glass to be able to see the picture. And then I mentioned that as a caregiver or as a parent, you may need to help position the patient in different ways to encourage different tasks. And so therefore, again, you may need to think about that as far as who is present. And then next slide. So I think one thing from a physical therapy standpoint that a lot of you probably can appreciate is that if you are on a disease modifying therapy, there are potential payer requirements that are requesting different functional assessments for your child or for you as a patient. Some of those payers, obviously, as we went through the COVID pandemic, did not, we're a little bit flexible in delaying the requirements for some of those. What I will say is that it's really important at this point in time that really those functional assessments be done in person, because it's very difficult to administer those assessments virtually in a standard way. And the reason that's important is the fact of the standardization. It's kind of like having your assessments done by different therapists in different facilities. They may see something a little bit different and grade it a little bit different, and therefore your scores change, not due to functional change, but due to the variability in how that assessment was performed. And so the same thing applies in a home setting. You may not have the exact height of a chair that should be used, or you may need different equipment for the upper limb function test that you don't have the standard equipment. And so therefore, if a standardized assessment is done through telemedicine, I think it's very important that it's documented that that was the case, and that it can't be directly compared to previous outcomes, to previous assessments that were done in an in-person setting. I think we just need to be aware of that and keep that in mind. And that being said, I will also say there's a group of us at different facilities across the country and actually internationally as well that are looking at standardizing a telemedicine assessment for physical therapy. We're in the middle of trying to put that all together, and hopefully we'll have something, because I do see that it could be beneficial even in the future, even when telemedicine isn't the primary way we're seeing patients. But so hopefully we'll get something put together soon so that we can do something, we can publish something kind of like the neuromuscular assessment that was published that Dr. Castro shared.
Could I just say something there, Leslie? What about, I know you guys are working on this, but at the same time, I think it's important to start talking to the payers and making sure they understand that this is going to be some of the ways that we're going to have this standardized testing, because what is happening right now in my practice is that they're asking me, we need the standardized testing to be done the way it was done before. Now they start asking. They were not asking for it last year, but they do start asking this year. And the families are like, why is this happening now? Because things are going to move in the other direction. So I think it's also important for you guys to look at that area.
Right. Yeah. Thanks. Good point. Okay. I think that's my last slide. So Stacy, I think you are next.
Thank you very much. So I am a dietitian at Boston Children's Hospital. And I think, if you ask dietitians around the country prior to COVID, if they thought that telehealth and a virtual visit could work well with nutrition, I would think 90% of them would have said yes. I think nutrition visits lend themselves very well to the telehealth or virtual visit. Maybe because there's, like with physical therapy, there's a lot of physical things going on just in the name. And also for the neuromuscular visit, I think there's much more physical exam going on. But, in a nutrition visit, a lot of our time is spent just talking about the foods and things that the child eats. There is one really important thing that we miss by not seeing children in person, and that is getting a good weight and height on them at the visit. because really those are the measurements that we use to assess growth. There's actually a couple of even other measurements that we do with children with SMA to help assess kind of muscle mass and fat stores. And of course, we're not able to do those unless the child is there in person. But when you're preparing for your nutrition visit, if possible, prior to the visit, if you have, a regular bathroom scale at home, it's extremely helpful if you can weigh the child prior to the visit. So, and I know, if the child is older, or if it's a teen and it's not a child that you're able to lift, I understand that it's going to be difficult to get the weight at home. But if you have a smaller child and or a child that you can lift, what I usually have my families do is one of the parent lifts the child, hops on the scale, holding the child, gets a weight from that, and then puts the child down and weighs themselves. Some of my parents don't really like to do that, but they'll do it for the visit if I ask them to. They're like, oh no, I don't want to weigh myself. But they will do it. And then you can either, subtract the weight of yourself and the child, minus your own weight to get the child's weight, or you can give me both of the numbers and I can do the math. But that's really important. I have, some families forget to do that before the visit, and then they'll actually do it during the visit, but then that takes away from some of our time that we might have to discuss some other things. So doing it prior to the visit is great. It's even harder to actually get a length on your child, but if you can do it, that's also extremely helpful, because especially when your nutritionist hasn't seen the child for a while, weight is just one piece of the puzzle. If your child gains a lot of weight over a year, but they had a huge growth spurt in length, it may very well be that their weight gain was appropriate. So if you can measure your child before the visit, that is really, really helpful. And I'm going to sort of tell you a little method that I use for doing this, because I know it can be difficult to get an accurate length on a child with SMA, especially if the child has contractions, you can't lay them flat out, that kind of thing. So the method that I use is actually a method that you can use whether the child is lying flat, or you can also use it if the child is sitting in a wheelchair. So I'm going to try to demonstrate this on my camera right now for you now. So I will usually take a clipboard or something flat, and I will try to put it as straight on their head as possible. And then I will take a tape measure and measure from the top or the top of the head, like right at the clipboard, all the way down to the hip bone of the child. So you can do that whether they're laying down or whether they're sitting. That would be the first measurement. Then you measure from the hip bone all the way to the knee bone. And then your third measurement is from the knee bone to the ankle bone. And if I know with some children, you can't actually flex their feet, but you want to try to get sort of to like, you want to measure to the bottom of the heel. It's not a perfect estimate, but I find that it works pretty well when I do it in clinic, and especially if I'm doing it every time, I'm doing it the same way. So it helps me track their trend in height. And if you get into the habit of being able to do that at home, or you have nursing help at home who can help you with that, it's really helpful to get that number. Okay, enough about weighing and measuring. So another thing that you might do in preparing for the visit is gather, some food. If there's specific foods that you want to talk about, have them handy. Supplements that your child is on. I know when I see children in clinic and I ask the families about supplements, people are saying, oh yeah, I think I give them this one, but they don't really know the dosage and that kind of thing. So the great thing about being at home is you have all those things handy, and you can just read off the bottle to the nutritionist what it is you're actually giving them. Same thing with formula or any like oral nutritional supplements they might be taking, or even the tube feeding formula, because, you know, sometimes companies produce formulas that just vary very slightly, like some are with fiber, some are without fiber, things like that. So if you have the formula handy, you can show the nutritionist exactly what you're using. The other thing is during the visit, your dietitian may ask about food portions. I do this a lot, definitely in in-person visits, and then as well during the telehealth visits. But the great thing about when you're home is that you can actually show me the bowls, the plates that you use, because sometimes it's hard for people to estimate food portions, like thinking in there, like what does a cup of food or what does a half a cup of food look like? But if you can show me the bowl that you're using or the cup that you give them beverages in, that helps me make a better estimate of what the portions are that you're using. And then my last tip in preparing for the visit, and most people hate to do this, but if you can keep a diet record for 2 to 3 days, or even if it's just 1 day prior to the visit, if possible, of what your child eats and an estimation of the amount, that can help a lot, especially, you know, if there are weight issues that you want to discuss, whether it's your child's not gaining enough weight or your child is gaining too much weight. Me really having a sense of exactly what the child is eating every day and drinking and that kind of thing can really help. So that's preparing for the visit. Could I have the next slide, please? All right, then during the visit, we had talked before about finding a space. Most people have kitchens, and actually during a nutrition visit, setting up in the kitchen is a great place to be, because kitchen is where all the food happens, and that's where all the nutrition happens. So set up in the kitchen if you can. It is, for the nutrition visit, it is important for your child to be visible, again, at least for part of the visit. Especially with SMA children, you know, like I always say, you know, plotting children with SMA on a growth curve does not always tell the whole story, because we know that children with SMA have less lean muscle mass. So lots of times they're on the lower part of the growth curve. So as dietitians, you know, us being able to look at the child and see that they have adequate fat stores on their body, even though their weight might be low, they might be perfectly well nourished. And so we may ask you to move the camera up and down the child. Let us get a good look at their limbs. We may ask you, you know, to lift their shirt, kind of, you know, lift their pant legs up so we can see their legs, their arms, and things like that. And that really helps us judge their state of nutrition. Another thing your dietitian might ask you is to see the food in your cabinets or pantry. We can tell a lot sometimes by what's stocked in there. You can always refuse if you don't want us to see, but that can be helpful for us during the nutrition visit. And then finally, you know, we can look at food ingredients and nutrition labels together. So if you happen to have a particular food at home, and you're wondering whether it's a helpful food for your child, you can either read the nutrition ingredients to me, or if you're asking about a particular food that you might not have at home, I can Google that food, share my screen with you, and say, you know, like, and then I can say, is this the food you mean? Let's take a look at this. Let's take a look at the ingredients. So that's another thing that we can easily do on a virtual visit. Okay, I think that was all I had for the nutrition visits. So if you can go to the next slide. And, you know, we were just sort of, all three of us we're going to give you our thoughts, I guess, about potentially the future of telehealth. I think from my perspective, you know, prior to COVID, nutrition visits were never covered by telehealth or by insurance. Virtual visits were never covered. So the great thing is that, you know, now they have been, and we're as dietitians, we're really hoping that some of this practice is going to continue in the future, especially for follow-up visits when we've already met a patient in person and they might require, you know, some close follow-up visits, at least initially. Um, from my perspective, there's no reason for that patient to keep returning to the clinic, you know, at 1 and 2 month intervals for a quick check-in on a nutrition visit. I think, you know, hopefully they're going to continue, but I think it's going to depend on different situations. I think it's going to depend on state law and different insurances and things like that. So none of us really know where it's going to go. I think the legislative people are still trying to figure it out, at least in Massachusetts where I am. But I'd love to hear from my other panelists on their thoughts as well.
Yeah, like I was saying before, I think that, you know, we don't know exactly where we're going to go, but I feel that we're going definitely more in person. So the visits are happening. Something that changed a lot in my clinic is that I used to see patients every 4 months because it was like we had nursing and it was every 4 months. So I was able to see them. But now I said, let's do 6 months because I don't want to be a burden for that family, right? We don't want to put more work for the family that is already busy with everything they have to deal with. So now we're doing every six months. For the older patient, like you have a type 3 patient, for example, that it's a teenager that is doing amazing, it's growing well, there are no issues. I'm accepting once a year sometimes. It also depends on the insurance of the patient. So some families are surprised, why do I have to go back? Because the insurance will ask for what we call clinic visits or clinicals, they call it, plus the motor function evals. So if we're requesting you guys to have to come or have a visit, it's because of that. It's because of the insurance, you know, different requests that they have. So I just hope that I hope that this doesn't go away. Like for you, for example, the nutritionist, for my nutritionist, the first time they told me my nutritionist could have it through telemedicine, I was so excited. I was so happy because it's one of the things that we really need help with. And sometimes it's limited by time, right? You come to clinic and you have to see the PT, the OT, the neurologist, the blah, blah, blah. And the poor nutritionist is waiting until the last minute and the family is already tired. So if they go home and if they are in their environment and they can show you everything they have at home, I think that's just great. So I just wanted to say that. I just hope I hope we go more to the normal part. We can have a in-person meeting hopefully next year. But in the meantime, we can be good at this. We can try to be even better at what we do.
I think you make a good point about because we had the same situation at Boston Children's. We had a multidisciplinary SMA clinic. It was once a month, and the person would come and would be there for like 3 or 4 hours and be seeing all the providers. And you're right, it's exhausting for them, and it's really tiring. And so since we've gone telehealth, we're not doing it all on the same day. We're scheduling the visits as needed. They can do neuromuscular on one day, they can do orthopedics on another, they can do nutrition on another day. And I think the families are much more engaged in that way because they're not exhausted and they're able to absorb the information better.
I think the only thing I would add is I think going into this, I was very much opposed to virtual visits and telemedicine. I'm a, you know, like I think both Stacy and Deanna both mentioned, you know, we want to be, we like seeing you, we want to be in person with you, but being forced into it, I think that we found that there are some benefits, and so I think that the hope would be that we can capitalize on those benefits, and yet still meet the needs in our in-person on-site visits as well, and kind of get more back to normal, but then maybe use telemedicine in a way that does make it easier on the family. And so my hope would be that we're able to keep those, and we'll see where it goes. But it has been a nice learning experience, and we'll see what the future holds.
And Leslie, it sounded like from what you said before too, that, not just, there may actually be a benefit to the PT, not just making it easier for the family, but also you being able to view them in their home space. It
Yes,
sounds like there is some benefit for you clinically from that, rather than just the family not having to come in.
definitely. Yeah,
Yeah. Okay, I think that we are ready now, I believe, for the questions.
Yes, thank you all so much. I'm just going to ask if we could stop sharing the slides, and then I'm gonna ask all the panelists. They're on video, so I'm just gonna make sure everyone can see them. Please, if you do have any questions, use the chat on the conversation tab there, and we'll get your questions answered. I know that you all kind of talked about just briefly in each of your conversations and your slides a little bit about the benefit as a healthcare provider. Do you want to just recap a little bit? What benefits as a healthcare provider do you really find? I know that it's so much better to be in person, but there is some of that you do see when you do a telehealth visit.
Who wants to take that one?
I can
Go
start.
ahead.
Yeah, so I think that even for us, even though I'm not the physical therapist, I think it's important for me to see sometimes their environment where the patient is. And like I say, mainly for the younger ones, that it doesn't matter if they're in my clinic, sitting in a bed, or they're in their house, running around or crawling or even sitting, we're gonna kind of get the same exam. So sometimes it's the same for me, but it may be even better for the patient, because the patient is going to be more relaxed. They're not going to be scared. They're having the doctor in front of them, and they may do things that we're not going to see otherwise. I heard many times, I swear my baby's doing this. I swear they have that. He has been sitting for 15 minutes, and they come to clinic and it's 1 minute and they go down to the side. So maybe that's one of the advantages that we see.
Deanna, I think that's an interesting point, because when they do say they do this at home, what's interesting as a physical therapist, for instance, sitting, maybe it's the surface that they sit on. And so the surface is different in clinic than what they sit on at home. And so being able to visualize that and kind of get an understanding of what is affecting their function in an environmental way is very helpful.
And I think for me, one of the advantages, like I just mentioned, is just being able to see the foods, the supplements, all of those things that they have right there at their disposal that they can show me on camera. So that's what I found to be most beneficial.
I think that's awesome, Stacy. I never thought even that you will ask them to show the pantry, because that's something that I tell them. Okay, so we have to get the sodas out. They know me. I'm like super strict with the weight, and I always ask them, and then no, we don't have that. We don't have it. And they will say, yes, mommy, we have apple juice, mommy. We
Right, I know.
like, okay, sorry.
Yeah.
So that's really cool that you can get into their environment and see exactly, because it's for their benefit. It's not like we're trying to penalize anybody. It's just like because we're trying to regulate their way to make those muscles work a little better.
Right.
Great. Well, thank you all so much. It was really great to hear all the kind of insight and things that you've learned from telehealth, and how families and individuals can really utilize the telehealth appointment. So really appreciate Stacy, Dr. Castro, and Leslie for being on today and sharing your feedback. If you do have questions, please feel free to email to type in the chat. The speakers are able to see the conversations and answer those questions as this platform is open for the next 2 weeks. So again, we thank you all so much for joining. There is a survey linked in the session page, and then you'll also be receiving a follow-up email with that link, and we do welcome any feedback that you have to share with us. Once again, we're incredibly thankful for the support from our sponsors for truly making the 2021 virtual SMA conference possible. Please join us. We have the final day of the virtual exhibit hall this afternoon from 1 to 3 p.m. Central Time. This is your chance to chat with the exhibitors, learn about their services and products, and see what they have to offer. And then also the more booths you attend, the more times you're entered to win a drawing, and we will be announcing the winners at this evening's closing session. So thank you again to our speakers and panelists today for being here. And if there's ever anything we can do, please always feel free to email us at familysupport@curesma.org. Have a great day, and thank you for joining us for the 2021 Virtual SMA Conference.
Thank you,
Thank
guys.
you all.
Bye.
Bye-bye.